Chaipo.
Yeah, Chaipo.
Okay. So this Chaipo, Samia Chaipo, from Switzerland, from Zurich, in Turkey, for the operational breast augmentation. Today, before the operation, I will talk to her about the general stuff, general information about the operation. And then we will get into some details, because the anatomy is different in every patient. And I will try to clarify her expectations about the operation. And I will inform her about the possible risks or complications. And then, if everything goes fine, we're going to do the operation this afternoon. And I'm expecting her to leave hospital tomorrow. And again, I assume that she's going to stay here for about 5 days or something. And then I'm going to get the drain off, and then she'll be free to go back to Switzerland. Okay? How old are you?
I'm 24.
24.
Yes.
And can you tell me about what actually bothers you about your breasts? Is it the shape, or just the size, or some asymmetries?
Yes, I want to have a bigger size. This a little bit bigger, and also I have a little bit of asymmetry. I want to make that
looking
yes,
symmetrical.
yes, and also I do that because I started to do a challenge for bodybuilding next year, and that's also that you have to do that when you want to do the challenge, because your body fat go away, so you press more than nothing, and when you do the challenge, so you don't have chance for win. So
okay, so you're concerned that when you start bodybuilding, you'll be losing some fat,
yes,
and because the breast includes some fat, it will go away,
yes,
and then you will end up with having smaller breasts.
Yes.
Okay.
Yes.
So as far as I understand, she has probably the size of her breasts, and because she's expecting to lose somewhere in the near future, so that she's sort of concerned that her breast size will be even smaller. And again, she's talking about some asymmetries as well. Symmetrical, best looking, the best fitting breast size. But actually, this situation is not like that in most of the cases. In most of the cases, the major problem, the most common problem is something about the asymmetry. And actually, with the breast augmentation, placing a prosthesis there, you do nothing about the asymmetries. That's something that, should be taught to the patient before the operation. There are some kind of asymmetries that could be corrected partly using, apart from the prosthesis, if you use the fat graft, you can do that. In some of the asymmetries, if the nipple, the tip of the breast is too much deviated and asymmetrical, and then the solution could be sort of bringing the nipple back to the middle line. The other thing is what will happen about the fat tissue. Although she's concerned about losing some fat in the breasts when she's losing some weight, when she's doing the bodybuilding, this is not something happening so often. Because the quality of the fat in the breast is different from the, for instance, around the waist or on the abdomen or in the thigh. These breast tissue in the breast is more structural than a storage place. If the patient genetically is predisposed to have more fat when she puts some weight on, and if she's losing the size of her breasts when she loses some weight, and that means there are some not only structural and storage fat in the breast tissue as well. But as I said, in that age, this is not something we see often. Especially in younger patients, the composition of the breast is more with the glandular tissue than the fat tissue. Only after menopause, the proportion of the fat in the breast tissue gets more, because the normal glandular tissue gets atrophied after the hormonal support. So what I'm going to do with Saima, is I'm going to check her breasts, and I will make clear, what sort of asymmetry she has. And actually, some asymmetries could get even worse, because if you imagine a small balloon that has a picture on it, and if you fill up the balloon, the fault, there's something wrong in the picture, will get bigger as the balloon gets bigger. So this is something, as I said, one of the most problem issues in breast augmentation before the operation, because usually most people don't understand or don't actually see the problems, structural problems in their breasts. And when you make the breast size bigger, usually the problem it gets more visible. Okay? So that's the first issue. And then I will check out the chest type, because there are some chests a little bit protruding. We call it pectus carinatum. And there are some kind of chests that have got hollow area that someone depressed on it. It's called pectus excavatum. So these differences again is important, because when you put the prosthesis there, some of the deformities get more noticeable. The other issue is, again, this is one of the most common issues about the breast augmentation, is the expectation of the patients about the size. Because there's no, today, so far, no way, to show that exactly what will happen when we put the prosthesis in there. We need to clarify exactly what size breast the patient is expecting and what size should be best for the patient from my viewpoint. So we will come to a solution in terms of the size of the breast before the operation. And of course, there could be some difference about just a little bit more, just a bit less. But actually, that decision is made only during the operation, because actually it's not just the wish of the patient. The base of the chest is one of the major determinant factor what size of, the maximum size of the prosthesis you can use. Okay, after the examination we will talk again.
Okay.
Good. Something to do with the bleeding, although I will, I usually try to keep it as clean as possible, no bleeding point left behind, but it is possible that, you might sort of overlook it, or some of the vessels could get collapsed so that, there will be no bleeding, but after the operation they could, they could open up and then start oozing.
Yes.
It's not bleeding or oozing.
Yes.
Actually, that's the reason that we are keeping the drains in the how will I say, pocket that we created for the prosthesis. So these drains will not allow any blood or anything accumulating with the prosthesis, which is one of the reasons, actually the main reason, to have the capsule after the operation. So the bleeding, whatever you do, could do something more. And if it happens, it will be happening on the first night of the after the operation usually. So if anything like this crops up, you will take it down to the operation again and clean up the blood, and then you're back to normal. Okay? The second possibility is the infection. Well, I've been doing this for about 21 years. I've never seen any patient having a problem with the infection. But is it possible? Yeah, it is possible. It could happen, from now on. It could happen. But this is a major university hospital, so we have no problem with the sterility or covering the stuff, etc. And the prosthesis, I'm going to open up here during the operation. So they are sterile. So we are taking extra, measures to keep everything clean.
Yes.
As I said, it's not something I should be talking about, or I do have some experience about to tell you much. But somehow this is, as any other operations in breast surgery as well, the bleeding and the infection is something that we should mention.
Yeah.
But as for the prosthesis and the augmentation, usually the unhappy patients are not because of the pain or because of the complications during the operation, but usually they have some, as I said before the operation, not clarifying the issues about the specific problems on that particular patient. Like in your case, there could be some asymmetries that patient expecting to be corrected with the prosthesis, but it could not be possible. That's why I'm insisting on seeing the patient and talking to the patient before the operation to make everything clear.
Yes.
And the other issue is the capsule formation. About 10 years ago, perhaps the quality of the prosthesis was a bit more irritating to the normal healthy tissue, and the capsule formation is a response of the body, something irritating the tissue. But today, with the technologies of the prosthesis, and since we are using the best prosthesis in the market, I do not remember any patient coming back with the capsule formation.
Yes.
Okay?
Yes.
And again, although, as I said, we talk about the size and, there the prosthesis will be replaced, if you still have some, problems about having it too much big or too much, smaller, that's something I cannot do anything about, because as I said, if we are having some criteria, as we talked before, and the showing that picture is somehow, making it more certain that, you would like to have some fullness around here.
Fullness.
But as I said, this is not only your fish, but the anatomy of the chest and the breast location is something as well, deciding what we could do.
Yes.
Okay?
Okay.
Any other question you have?
That's all, thank you.
Good. So did you have any surgery before?
Not.
No. This will be the first general anesthesia surgery in your life?
Yes.
Okay.
Yes.
You know that although people think having more than one anesthesia or surgery is something having some risks, it's actually the contrary to this. If you have more operation, you will be safer for the anesthesiology. So, because you are this is the first time you are having the operation.
Yes.
So, as I said, we will talk to anesthesiologists and they will talk to you about your history, the risks that involved, because it's not my field. And as I said, after the operation, because I'm not putting the prosthesis on the muscle, I'm not expecting you to have too much pain. So I think everything will be fine tomorrow morning, and you'll be discharged here tomorrow morning. You'll go to the hotel, and Dre will be there. And I'm going to see you again on the 5th day. Take Dre off, and then you'll be fine.
Okay.
After the prosthesis, some people are talking about wearing special bras. Well, if you want to have, wearing some bras, it will not be the coming 4 or 5 days, because my dressing will be there.
Yes.
Only then we will talk about what sort of bra you will have after the operation.
Okay.
Okay?
Okay, perfect.
Good.
And one question, the fullness I want, that's not really possible like a picture, but I become more fullness now with the implant.
Say it again.
That's true. I show you the picture of
Yeah.
that, and I want to have more fullness here.
Then the picture.
That picture I saw.
Yeah, that's actually the maximum.
Yes.
You can't give more fullness,
But
more than...
no, I don't want to have more. I want like that, but is that possible to have like that or not?
Well, I do not know.
Yes.
Okay, during the operation, I'm going to try I'm talking about the base, okay?
Yes.
I have 2 or 3 options with that base,
Yes.
okay? I'm going to try that one and the other one, because
Okay.
this
Now
base
I
is something, putting the
Okay.
limit. I cannot use something like this.
Yeah, of
So
course.
with that base, I'm going to use the biggest one, and I will see if everything is fine. If I find it, too unnatural, I'm going to put it a bit smaller.
Yeah.
If I put the small one, if it's okay, I can go for the bigger one.
Oh.
Okay? But I understand
Okay.
that you would like to have as full as possible the breast shape.
Yes.
Okay?
Yes.
Good.
Okay.